Okay, good evening, guys, and thank you for joining me tonight for my special call with Dr. Emily Cumming, who is a chiropractor. I asked Emily to come on my customer call this month simply because she's someone who I've been personally using or going to for a number of years now, in between Dr. Peter Cockram as well. They actually work at the same clinic, which is Wellness on Beaufort Street in Mount Lawley in Perth. And I absolutely love their technique, their approach to chiropractics, and they've definitely played a big part in helping keep my spine and my nervous system intact, and my sanity on a lot of days as well. So I generally come in and, Em might be like, what's wrong? And I'm like, oh, I'm everywhere. And she's like, no worries. And by the time I walk out of there, I'm just like, oh, new human being. So I thought it'd be really good to have her on the call tonight, just to share, I guess, a little bit more on what actually, chiropractic is, because I know that I often get questions around it and what's the difference between that and physio, when should I see one? And, I just wanted Em to sort of give a good grounding of what it is, debunk any myths, maybe possibly direct you into, whether it is for you or not and the approach, and also really just to have her come in, as obviously whole food nutrition is a huge part of what I, practice and preach and share with you guys. And it's something that Dr. Emily can also say is important in keeping your spine and nervous system in check. So we're all on mute, so that's fine and beautiful. Before we get started, I'll just give you a bit more of a rundown on Dr. Emily. So I'll just grab her bio and pop it up. Okay, so Emily is a chiropractor. She's also a Pilates instructor. She's got an interest in a broad experience in sporting injuries and rehabilitation in particular. And she also emphasises a multidisciplinary approach to patient care and actively cooperates with complementary health professionals, such as myself, to maximise patient care and recovery. So, Dr. Emily, thank you. Sorry, I'm being very formal. Normally I'm just like, hi, Em, but I thought tonight I really keep it formal, Dr. Emily. Thank you so much for doing this tonight. Honestly, I love to add value to my clients and any of my followers, and definitely share things that I feel passionate and connected and authentic about, and chiropractic and that whole industry and treatment is one of them. So I just love to start with you sharing a bit about yourself and how you actually got into the chiropractic industry and why you fell in love with it.
Yeah, thanks for having me, Carla. So chiropractic for me has been a pretty long journey. I, at the age of 12, was diagnosed with a condition, a spinal disorder called scoliosis. It's when the spine curves slightly to the side, as opposed to going up and down, predominantly in women. And from the age of 12, I actually started doing Pilates. I was under chiropractic care and physio care. And it was all to avoid surgery of my spine. So if you have, and only in extreme cases, so it was while I was growing and developing to make sure that I was the best I could be, and have the most functional movement and all of that, because spinal surgery is where they put...
Oh. Bear with us. There we go.
Did I go?
Yeah, I think your internet might just cut out for 2 seconds. That's all right.
Okay.
Keep going.
2 seconds. So that's what I did, and I just found that this multidisciplinary approach really helps me. I was also a very skinny kid, which is fine because I was really in sport, but if you're slightly overweight, that really affects those sorts of conditions as well. And so when university came, I was tossing up between a few different health professionals. I knew I wanted to work with people, and chiropractic just seemed to be the best fit for me because I wanted to work in a private setting and also have that sort of flexibility of patient bases. So we work everything from school-age children to like the elderly, and I really like kind of really covering my bases as opposed to specialising too much in a sort of clinical setting. So yeah, that's what I do.
Oh, fantastic. And you've been at Wellness Beaufort Street for how long now?
Over 5 years now, actually.
Wow.
So there's a sort of place that once you get a job there, you never leave. It's a family-based clinic, and it's got a really nice approach to it. It's really patient-centered, which means every patient's got their own sort of individualized program, and you get to see children grow up, and the area is beautiful. So we're really lucky where we're at, and we also sort of have the flexibility and scope to just give everyone what they need. And if we can't help, we do refer out. So yeah, I'm very happy there.
Yeah. Before we go on, I will share actually that I used to, when I was in my student days and, you know, money is tight, I used to head off to Murdoch, where basically all our chiropractors in Perth come out from, and I'd go see the fifth year students because they were, you know, in clinic with obviously a teacher watching them. And Em was one of the students that would treat me every so often. And then I remember one day I'd been going to Wellness on Beaufort Street, and one day I walked in and I was like, hi, and she's like, I work here now. I've been kind of flirting my way between her and Peter, whoever's available, ever since then, because they're both doing wonderful jobs. So small world. But and just going on, I would love for you to share now, you know, really what the basis of chiropractic is. What does it generally involve, and what can someone expect in their first visit if they're not sure? Because I know a lot of people think that it's literally just about cracking the back and neck and walking out.
Well, every chiropractor is different, and I'd probably say, like any sort of healthcare professionals, physios or otherwise, to always try and find one that suits with you or your philosophy. And a recommendation, even by friends, is a really good way to start. What a chiropractor, like what we do at our clinic, and that's probably the best way to talk about it, is when you first come in, we have a very thorough questionnaire. It's over 6 pages long now. And we'll take a full history. So we'll have a big chat and find out what's going on with your body, all your past medical history, everything from medications, past surgeries, to really benign things like, do you have problems getting out of bed in the morning? Or, you know, just really little, we call those activities of daily living, which is important to you, but maybe not super important from a medical point of view. We then do a full physical exam. So we'll check reflexes, do all the orthopedic testing, and chiropractors' whole aim is to give you a diagnosis. So it's really there to be like, why have you come in, and is this something we can look after? If we can't look after your condition, or if we think it's a lot more complicated, we do refer on. And a lot of times we might just be a part of the puzzle. So like you were talking before with nutrition, if we think that a person is, their body isn't functioning effectively, whether they might be overweight, we might think that they might have an allergy problem or something like that. That's where we refer on to. But if we can help you after the physical exam, we may take imaging or we may not. At our centre, we don't take imaging. We just send you off for bulk field imaging. And then if we decide that you're an appropriate patient, we will start with some treatment and then just play it by ear. So we call it usually a working diagnosis. So it's nothing set in stone. There's no, everyone's individualized. There's no sort of, I can't tell you how many sessions you'll ever need. I can't, but depending on the person, you may need a couple, or it could be quite serious and you might need a little bit more care from us. But really, you're an individual, your condition's completely individual, and you need to be treated as such. So, but I would always say a recommendation is a really good way to start if you want to see a chiropractor. And if you're not comfortable, like anything, there might be someone out there for you, but maybe you haven't met the right person yet to look after your body.
Yeah, absolutely. And I love that because it's so true. You know, every time I go in, there might be certain, you know, similar techniques you guys use, but the treatment is always different based on what you're picking up. And I definitely know that when I first started to see a chiropractor, I needed to go in for more regular sessions while my body was getting used to it and working its alignment to stay there. Whereas now it's very much a maintenance sort of thing for me. Personally, everyone's different. I'm in there maybe every 3 to 4 weeks. Sometimes I need to come within a week. If Emily's gone, what have you done to yourself? You need to come back next week. But it's just that whole maintenance really with your health, which becomes really, really important. So, and you know, what's your advice on finding the right chiropractor? Because you just said perhaps you haven't found the right person, and you know, you don't want to be turned off by it just from one experience that perhaps wasn't what you wanted, when if you just looked elsewhere, you might find that it's absolutely fantastic for you.
Yeah, with chiropractic, when we graduate from university, you can pretty much specialize or become whatever practitioner you would like to. I've had patients find me, and not through us advertising, from other people talking, even on Help a Sister Out forums, or something along those lines. I would say 90% of our patient base is direct referrals from people who recommend us. We don't advertise at all, which is a lovely thing to say, that we are a practitioner built on that. But there are specialist chiropractors. So there are pediatric chiropractors, and there are chiropractors who are very special and interested in particular fields. There's neurological chiros who specialize in neurology and things, or children with learning difficulties, or things like that. I probably would have to ask around. Most chiropractors won't advertise due to a few reasons, but it's usually best if you can kind of get your patient base on a referral only system. And yeah, that would honestly be the best way. In saying that, lots of us do have great relationships with our local GPs. So I'd probably even ask your local GP. They're really your gatekeeper. So on Beaufort Street, lots do refer out to us, and we have a really good working relationship. You pretty much want someone who's in your community and is really keen to access all the services as well. Because unfortunately, we're not a silver bullet. We can't fix everything. I wish we could. But it's more about being a part of that team. So if you even speak to, I don't know, your local dietitian, and they might have someone who recommends, or lots of midwives recommend us, or so it's more about just trying to get someone who is part of that community and go from there. But yeah, that's the best way. Yeah.
Yeah. I think that's what I love as well, that, you know, there can be practitioners, not just in chiropractic, but other industries that are very my way, straightforward. This is the way to fix things. Whereas I love that you guys are very open to understanding that, you know, sometimes, you know, it's out of your scope, but often it's just working with those referral partners together to solve the puzzle, I suppose, which is the patient or the client. So I love that, you know, about you guys. So going on to that, I think one question that you would get all the time, and we spoke about this when we sat down to talk about doing this, is, you know, what's the difference between a chiropractor and a physio?
Yeah, it's a really good point. And in many ways, a manipulative physiotherapist, which is when someone does an extra master's, it's a year longer for physio, and a chiropractor are very similar. The physios can work in hospitals and chiropractors can't. Chiropractors are very limited to private practice. And physios can specialise in very particular areas. So if you have a hip replacement, your physio will teach you how to walk again, and go to the bathroom and do those sorts of basic rehabs. Physios are really the spinal specialists, and that's the best way to talk about it. The spine is sort of our thing. We're very, very good at treating it. Physios can do a lot of treating, and a manipulative physio can manually adjust. In saying that, not actually all chiropractors manually adjust. Lots use very low force techniques and don't do that cracking that everyone thinks we do. And we don't even treat that on every client. It's really patient specific. Physios definitely have extremities covered. They're your knee rehab people. They're your tennis elbow people. You might even get a hand physiotherapist or someone like that. But when it comes to overall spinal conditions, or even like scoliosis that I was talking to you before, chiropractors are really the ones who, that's their field. I would say a lot of percentage of my clients are your disc low back injuries, and we're very good at maintaining those as well. Like I said, though, I see physio, and even though I'm a chiropractor and I'm married to a chiropractor, because I have quite large shoulder instability, which is just something I have to live with, and I rehab that, and I see a physio for that because that's the person I find works best for me. So they're very complementary, and they can be used really efficiently together, but for different conditions there's different things that work best. But the best thing is, if you're not comfortable with the care or you're not happy with what you're receiving, I'd always look for getting a second opinion, and whether or not that's based with a chiropractor or another chiropractor, or even getting an opinion from a physio or another manual health care practitioner. Always make sure that you're comfortable with what you're getting, because if it doesn't feel right to you, maybe it's not, or if someone's confirming what you've already been diagnosed with, then that's just that extra reassurance. Yeah. So yeah, That's the difference.
And I love that you shared that you see physio too, because between the care obviously you get on your body through chiropractic, and then with the physio, you're actually enhancing what both are doing. And, you know, I can speak for myself. For years, being a dancer previously, we generally get sent straight to the physio for injuries or just soreness and all of that. And I know I had ongoing issues, particularly with my right hammy for years that I was getting looked into. And it was until I was actually getting chiropractic treatment regularly and my body was getting aligned and holding in the right way, then all those other treatments and just in general, that injury wasn't flaring up. And all it took was just getting to the spine and the nerve and the skeletal system. So, yeah, absolutely. They can work together beautifully. If people are open to it, and as you said, the experts in each field are open to making sure they complement each other. So that's fantastic. Just in case anyone's on here going, but I don't want to leave my physio. It's, as you said, they work differently. So I wanted to ask you, what's your opinion? You touched on it lightly, on the role that nutrition plays when it comes to getting the best results, you know, out of your patients, for example.
Yeah, this is a really interesting question, and nutrition obviously is the fuel for your body. It's what we run off, and if we're not getting that, or if our body's reacting negatively to what we're putting into it, it actually can then have a lot of physical manifestations. What I mean by that is lots of people have abdominal bloating. Now, for many reasons, it could be an intolerance, it could be a sensitivity, it could be a really nasty little combination, and that seems to be sort of the thing at the moment: inflammation and gut inflammation, gut health. We don't know enough about it. It's not my field. I don't want to go into it too much, but if someone has abdominal bloating, they're putting a lot of inflammation straight onto their back. So if I have a person with a back injury and I notice their abdominal bloating, if I notice a person who has really poor pelvic floor activation and their bloating's pressing directly onto their pelvic floor, it really makes our treatment less effective, because it won't hold as long. If they're swelling, inflammation is used to bring white blood cells to the area a lot of the time, and that's the sort of thing that helps us heal. But if there's too much of it, like when your ankle's completely swollen, nothing's going to heal. You need to get it down to a manageable level before it starts to heal. We only have basic probiotics where I work, because we understand that that's not our field to really prescribe. But there has been many occasions, and more often than not, where I'll be like, I know what your condition is. I know I've done your orthopedic tests and you've got this spinal. You might have a sprain of your spine, like, which is called a facet syndrome, or sprain of the back. But because of that swelling you have on your stomach, it's actually going to encourage the healing time to be longer. So if we can get that under control, then that really will speed up your healing time. Or if, I'm actually pregnant at the moment, which is great, but you bloat a lot when you're pregnant, and it can put pressure directly onto your pelvic floor. And anyone who's pregnant will know that pelvic floor doesn't work quite the same when you're pregnant. But that's very similar to people who have that sort of constant abdominal bloating. And so if they're not being able to activate it, they can't activate their core effectively, maybe when they need it, and they'll be more prone to back injuries as well. That's very basic what we're talking about now. But if someone's not getting, and we're not even talking about people who get migraines or headaches from having, food that doesn't agree with them. We were talking before about my migraines, and if I have peppermint and there's a certain combination, if I have some foods with MSG in it, for instance, I will get a headache. So that real direct correlation between your body having a reaction to it, and it then can manifest sort of muscles and bones, maybe you want to call it, but not all headaches can be fixed with a chiropractic treatment, because it wasn't the cause. It wasn't out because of something you've done activity-wise. It wasn't because you had tight shoulders because you've been studying too much. It was because you've eaten something or something hasn't agreed with you. And that's a chemical balance. And chemicals in your body, well, that's your whole body. So, that's how we work. We're hormonally charged. So it's really important to make sure that you look at your body as a whole, and you treat your body as a whole as well. And that nutrition side of things is really important to get right. But everyone the gut's the it thing at the moment, but that's just because we don't know nearly enough about it. and we're just realizing how important it is. So yeah.
Absolutely. I think there's enough evidence out there that having a good whole food based diet, as less processed as possible, is going to contribute to a healthy body, healthy recovery, and also obviously minimizing inflammation, which then, as you said, plays a part on whatever you're doing for treatment and helping that whole and heal better. So I'm glad that you touched on that, because it's interesting. Every expert that I have on here and talk to, every single one of them, no matter whether they're colonics, whether they're a life and soul coach, whether it's around gut health, all say the exact same thing. Nutrition is so important in what gets done. So, and just to finish off, I'd love for you to maybe give us your top 3 to 5 tips on keeping your body, your spine, and your nervous system in check, so that perhaps we can be seeing you, and I mean this in the best way, as less as possible.
Well, that's the aim. Like, the aim is always to see us as little as possible. We want you doing well. I love it when people are like, I've been amazing for you. The best thing is to be active. Like, an active body, our bodies are meant to move. We're designed to move as creatures. Unfortunately, lots of people have more of a sedentary lifestyle than they can. And even if you might not feel like your back or wants it, most conditions love activity and movement. So light force, of course, like if you can avoid it. The next thing is to make sure you're in a really healthy weight range and you're eating really well. The reason for that is if we are carrying extra, this is going to be fun because I'm putting on heaps of weight right now. If we are carrying more weight than we need to, it is putting a lot of load on our body. And the next thing is to make sure you're really diverse in everything you do. Too much of anything is not great. So I love running's great, but if you decide to run a marathon every month, that's putting a lot of stress. So if you can mix up your activity, mix up your daily living, and mix up your food, make sure you've got a really good variety of everything. The more colours, the better. That's the sort of best way to live. And they're just life things. They're not sort of fads. That's just the best way to be. So I love people who've got lots of different interests, or mix up your gym routine. Don't do the same thing every day. Don't just be on the stepper for an hour. Not that there's anything wrong with the stepper, but just try and keep your body moving, keep your body nourished in food and activity. And that's the sort of best tips I can give you. So yeah.
Awesome. I mean, yeah, and I love what you said, keeping things mixed up. I like to run a lot. I do mix things up, but, for example, the things and the sorts of tips that, Em and Pete and the practitioners in there will give you are lots of take-home things as well, which is great. I know that I was having massive issues with my knee, probably from the running and just not enough rolling, etc. And for example, Dr. Pete said to me, you need to start using the foam roller more. I said, I can't be bothered. He said, great, I'll see you when you've had surgery and a big scar down your leg. I said, no worries, I'll start rolling. And he's very straightforward. And you know what? That was the best thing that ever happened, because I'm able to keep on top of that now between what him and him do for me. So there's always little things that they will give you that you can do at home and make the time for that. Again, are going to enhance what they're saying and save you coming in all the time. So Dr. Em, thank you so much. Now, we've only got one live caller on here tonight. Beck, do you have any questions for Dr. Emily at all? No? All good? No worries. Just thought I would throw it out there. So, guys, Emily is at, as I said, a trillion times over, Wellness on Beaufort Street in Mount Lawley. Now, if you've been interested in what she's had to share tonight and would like to go in and have an initial consult, and if you feel that there's something that perhaps those services could help you with, if you are not in Perth, or even if you are, but it's a little bit of a distance to go away, both Dr. Emily and myself are more than happy to recommend chiropractor that might be closer to you, whether you're on the East Coast or overseas, we'll try, but definitely within Australia that we can recommend that could be suitable for you to go to. So thank you once again so much, Em. I appreciate you being on, and I know this call is just going to be fantastic to pass down the line for anybody looking at chiropractic treatment.
Thanks so much, Carla. Have a wonderful night.
Thank you so much. See ya.